was a shame to see people with HIV and AIDS who, remember or can speak to what it's like living in the AIDS crisis right now, having to kind of work through now living with an added or new crisis.
Actually, it reminded me of the initial time of the AIDS epidemic when it was going on. I was not in the United States during the height of it to witness The Walking Dead, but it was the same type of atmosphere that I had people looking at me in a way that, I don't want to touch them, the same way that I felt when I was first diagnosed HIV positive. I thought, oh my gosh, no one wants to be around me. I got the same feeling that people were pulling away from me in the elevator or in other things. I said, I've been through this before.
Our community is not strangers to pandemics and epidemics. We've been dealing with the HIV epidemic for decades now, and there's a lot of trauma that comes with that, of course. What's really interesting about COVID is that all of the things that activists and HIV activists in particular have been screaming about how our healthcare system is broken in this country, really kind of were highlighted by this pandemic.
For me, COVID did not particularly freak me out. Since I've been living with HIV since 1984, I've been accustomed to doing things necessary to keep myself safe. The only negative impact I felt was the lack of human contact. That really weighed heavy on me. I missed hugging people.
The LGBTQ community is bearing the burden of COVID, just like we bear the burden for HIV and AIDS.
In a lot of low and middle income countries around the world, people don't have access to vaccines. And it reminds me a lot of what happened in the HIV epidemic when we had treatments that were only available to people here and not available internationally. And a lot of the people who fought to make those things available globally were queer people. It was the queer community who, didn't just shrug their shoulders when we had access to ARTs and antiretroviral therapy, and not even everyone in this country has that, but actually fought to make sure that people around the world could get the care that they needed.
The vaccine rollout hasn't been that successful for folks who are immunocompromised and who are disabled, the way that there hasn't been that much targeted outreach in a way that honors the complexities of Black people in their neighborhoods, just things about the entire way that our government and the way many governments have handled the crisis hasn't been with care and intention with these specific communities. There's reasons why trans people can't just go into all sorts of health centers and hospitals and feel comfortable to access the vaccines in the way that others do.
I was number 5 of getting the COVID-19 vaccine study with Moderna, number 5 of 30,000. I've been vaccinated since September. A couple of the primary reasons I went to this study is because Black people are woefully underrepresented, and I wanted to see how it reacted to HIV. Initially, neither Pfizer nor Moderna wanted us in the study, and the HIV community rose up and said, oh, hell to the no, we will be a part of this study. As it turns out, COVID-19 vaccine, my HIV, and my viral load play very well together.
When you're dealing with medical care, for queer people, I think we have to talk about stigma and the stigma that people face when they're going to get that care. People have had bad experiences in the past with their practitioners. So I think when you have something new come along that's threatening people's lives, and you have a short amount of time to reach those people, it's a big challenge, For this year's Queer Liberation March, ACT UP is helping organize COVID vaccinations for the march itself. We're talking to the Department of Health and Mental Hygiene about where they should be placing vaccination tents to supply the march. This is a march that's going to have about 40,000 people. So we're expecting that, even by late June, there still might be 20% of the community at least that's not vaccinated. Now we're at the point where we need to bring vaccines to where the people are right now.